We've known for a really long time that being mentally active likely lowers your risk for dementia. But what this study is telling us is that the people who did this training had a 25% lower risk of dementia based on Medicare claims data. What's particularly good is that the training was quite modest. People did a task for an hour, twice a week, for about 5 or 6 weeks. And then a year later, they did the same task for about 4 weeks. And again, after 3 years, they did the same task. So it's not a lot of training, but in this case, it was clear that if you did it, really made a difference. My guess is that when people are engaging in this task, that they're making more brain connections. They're improving the connectivity in their brain. We have pieces of information that we think will make a difference in terms of people's risk for dementia, but it's always been sort of on the periphery, and I'm hoping that this will accelerate research in that area. It's an enormously costly disorder from a public health perspective. The estimates are that it costs $400 billion a year to care for people with dementia. So if with this kind of cognitive training you could reduce that risk by 25%, you could actually save an enormous amount of money. And there have been several surveys showing that 80% of people, if you ask them what they fear the most, is Alzheimer's disease, because it's losing yourself. So we have to find better ways of treating the disease and preventing it. This study wouldn't have been done without funding from the National Institutes of Health. They took a big chance, and it was risky. And here it is paying off in such an extraordinary way.